my name is Suzy. I'll be your nurse again today. I'm here to just do our final part of the head to toe assessment. Are you okay with that?
Yeah.
Okay, can I just see your ID band? Can you tell me your name and date of birth?
Sam Nemes, Jan 1083.
Okay. Actually, before I begin, I'm just going to check the policy and procedure manual as well as the doctor's order. Now I'm going to quickly go wash my hands and I'll give us some privacy. For the first part of our assessment, we're going to do a musculoskeletal test. So to do that, I'm just going to get you to stand up and face away from me. And then what I'm going to get you to do is I'm going to get you to walk down the hall, heel to toe, and then turn around and walk back towards me on your tippy toes about half the way, and then on your heels for the rest of the way. Can you do that?
I can.
All right. You're such a good patient. He's so compliant. Okay, that's good. Now if you can turn around and walk on your tippy toes. Kramer, come here. Kramer. Okay, and then now on your heels for the rest of the way. Okay, did you have any problems doing that?
No.
Were you in any pain at all?
No, it wasn't.
Okay, so I noted that his gait was smooth and there was no rigidity when he was walking on heel to toe or on his tippy toes or on his heels. Now, since we're in this position, we're going to do the Romberg test. And to do that, I'm just going to get you to stand with your feet together and hands at your side. And just stand looking forward for about 20 seconds. And we're going to count 5, 10, 15, and 20. And now we'll do the same thing with your eyes closed. And I'm just going to check your balance while you're in this position. So you can go ahead and close your eyes. And we'll do this again for 20 seconds. And I'm just going to note if there's any swaying. Some swaying is normal. And I'm here to catch you in case you, although you're bigger than me, I would go down hard. But you'd have a soft landing. Okay, you can open your eyes. I didn't note too much swaying. There was a little bit, but not too bad. Since we're in this position, I'm going to see if you can balance on one foot at a time. So we're going to do a shallow knee bend. So if you can just put your knee up, and we'll see if you can balance. Okay, and then put it down. And then same thing on the other side. Okay, that's awesome. So you're able to balance, and that's checking your trochlear nerve. So also we're going to check the range of motion in your cervical spine. So if you can just flex your head forward for me, and then hyperextend it back, and then bring it back to center, and then bring your ear to that shoulder, and then your ear to the other shoulder, and then back to center, and then just rotate your neck, and then to the other side. Did you have any problems doing that?
No.
No pain at all? Okay, and then we're going to do the same exact movements, but we'll use the trunk and the hips of your body to do that. So if you can flex forward for me, good, and then hyperextend back, good, and then hands to your side, and if you can just lean to that side, one side, okay, and then lean to the other side, okay, and then rotate your hips, or your trunk, and then rotate the other way. Okay, so did you have any problems doing that at all?
Maybe a little bit of stiffness in my upper back.
Maybe it's time for a massage, or maybe we'll do an ice pack later. 15 minutes on, 15 minutes off. Okay, so now since you're standing, I'm going to get you to turn around, and we're going to check for any kyphosis in your back, and that would be any curvature up here or a lump up here, and I'm not noting any. Now if you can bend over at your hips and touch your toes, and I'm just going to check along your spine for any scoliosis, and that's any curvature of the spine, which I don't note, so you can go ahead and stand up. And then you can have a seat. That completes our musculoskeletal assessment. Excuse me. And I'll wash my hands one more time because I coughed. It's just a post-nasal drip. It's all good. Okay, now we will check your cranial nerves. We're going to start off by checking your cranial nerve number 1, and that's your olfactory nerve. And that's just to check your sense of smell. So do you have any problems breathing out of either one of your nostrils?
No.
Have you noticed any stuffiness?
No. No,
so they're clear and open and patent? Good. Okay, so I'm going to get you to smell one, and just let me know what you smell. If you can describe a smell to me.
Peppermint.
It's peppermint. And then I will get the second one and just see if it smells different than the first one.
It does smell different.
What does it smell like? Can you describe it?
Folgers instant crystals, coffee crystals.
It is. Sorry, you're at that hospital that only gives you instant coffee. Okay, so that is good. It means you're able to differentiate between the smells, and you're even able to describe the smells, which was good. Now we'll check cranial nerve number 2, which is your optic nerve. And what I'm going to do is I'm going to get you to cover one of your eyes with this eye coverer. And I'm going to measure 14 inches away from your nose. And I'll just hold this, and I just want you to read the smallest line that you can read. So this is, I won't poke you. I won't poke you. That's about 14 inches. So what is the smallest number that you can read, or smallest line?
PFCDTZLE.
Okay, and then if you can cover the other eye, and then we'll just do the same thing on the other side. And just read again the smallest line that you can read.
PFCDTZLE.
Okay, so on both of them it was the last line, which tells me that you are able to read at about 20 feet, which most people can read at 16 feet. So I mean, that's as low as we could get. So we can't say for sure if you could even read better than that, but it's equal bilaterally, so that's good. We were just testing for myopia there. Now we're going to check cranial nerve number 3, 4, and 6, which is the ocular motor trochlear and the abducens nerve. And we're going to check a couple of different things for this. We're going to start out by checking your peripheral vision. So if you can cover one of your eyes again, and just let me know when you can see my pen light coming into focus. So we'll just come from a couple different angles.
No.
Okay.
No. No.
Okay. And then we'll just switch eyes and do the same thing on this side.
No. No. No.
Okay. So it was about equal bilaterally, your peripheral vision. So and it looked like it was within the expected range. For next thing we're going to do is we're going to do the cover-uncover test, and that is just going to show me any deviation or any jumping. So I'm just going to cover one eye, and then I'm going to quickly uncover it. If you can come around, Brianna, and just do this, that would be great. So I'm going to start by covering your right eye, and we'll check the deviation in, well, actually we're going to start by covering your left eye and check for deviation in your left eye. Do it one more time. Okay, I didn't note any deviation in that eye. And we'll do that one more time again. And there was some slight deviation in your right eye, which I will note down in the chart. After this, we're going to do the 6-point test. So what I'm going to get you to do is just follow my finger to 6 different locations. So we're going to start in the center. And do not move your head. Just follow it with your eyes. Getting a little hard after a long day. Okay, so your eyes, they moved in unison. They moved smoothly and without any rigidity, so that was good. And since we're in this location, if you can just follow my finger again, I'm going to bring it to the tip of your bridge of your nose. Okay, and I was just checking your accommodation reflex there. And again, they moved in synchronization with each other medially to your eye. The next we're going to check is the pupil dilation, or pupil constriction, pupillary constriction, using a pen light. So what I'm going to do is I'm going to bring in the light from the side, and I'm going to check the other eye for the pupillary constriction. And then we'll bring it again on this side. Okay, and I noticed that when I bring it over to this eye, that this eye also this eye pupil constricted as well as the other one. So that is within the expected, what we should be finding, so that's good. After this, we're going to check your trigeminal nerve, which is cranial nerve number 5, and that includes we're going to do 2 sensory tests here, or assessments, and 1 motor test. And to do the motor test, what I'm going to do is I'm going to check the muscle in your temporal lobe as well as the masseter muscles, and I'm just going to place my hands on them, and if you could just clench down when I landmark. Don't clench down on my fingers, but clench down with your jaw. And then here. Okay, so I felt the clenching on both sides, and it felt equal bilaterally, so that tells me that the strength is equal bilaterally as well. Now we're going to just check to see if you can feel a few different landmarks on your face. Again, just let me know when you feel it touching your face.
Yeah. 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 Mm-hmm. Yes. Yeah.
Looks like you got some sun today. No. Okay, so that was good. And then the last test we're going to do is the corneal light reflex. And if Brianna, if you can just come around again. I'm just going to shine the light at the bridge of your nose, and I'm just checking for the light reflex in your pupils. And it should be equal on both sides. And I can see that it is pretty much equal. It's more centered on this one and more medial on this one, but it's not too far out, so that's good. I'll just make a note of that, slight deviation. After this, we're going to check your cranial nerve number 8, which is your acoustic test. So we're just going to, I'm going to get you to cover one ear while I whisper something into the other ear.
Thank you, Brianna, for recording.
Incorrect.
And then we'll check the other one, and I'll just whisper something into this ear.
I'm not repeating that.
It wasn't that bad.
I love coffee.
Okay, that's good. So he was able to repeat what I said to him. Doesn't have much of a sense of humor though. Okay, we're going to check cranial nerve number 9 and number 10, which is the glossoopharyngeal and also the vagus nerve. And to do this, I'm going to use a tongue depressor. I'm just going to make sure I use yours and not mine. And I'm going to shine into your mouth. I'm going to get you to open your mouth, stick your tongue out and say ah, and I'm going to depress your tongue, and I'm just going to look to see if your uvula and your tonsils move in medially. It's just checking your gag reflex. So you can open up and say ah. Okay. Yes, they did move in somewhat medially, but not very much. So I'm going to make a note of that as well. Was it uncomfortable for you to have it back there?
No.
Oh, okay. That's awesome. I'll just make a note that it didn't move in whole lots medially. And then I'm going to also check your, this is the last cranial nerve that I'm checking. I'm just going to check cranial nerve number 11, which is your spinal accessory nerve. And to do that, I'll just get you to shrug your shoulders up and then back down. And then when I place my hands on you, I'll provide some resistance. And if you could just shrug one more time upwards. Okay. I don't feel like that resistance made much of a difference, but it was, the strength was equal bilaterally, which is what we were looking for. Then we were going to move over and check your neurological assessment. What I'm going to do is I'm going to touch over various parts of your body, including, well, I'll just touch over some areas, and then you let me know when you can feel it, okay? So if you can just go ahead and close your eyes, and just let me know if you can feel this.
Yep. Yes. 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 Yes.
Okay, that's good. And then what we're going to do after this is we're going to do the rapid alternating movement. So to start with, we're going, I'll just get you to touch your thumb to all of your fingers one at a time. And then if you can go faster each time. Okay, good. And then the next one, you can stop now. We're going to check to see how coordinated your hands are. We're going to get you to pat on your knees like this and then like this. And actually, I'm just going to get down at your level so I can do it with you. And we'll do it together, and we'll start. See if you can keep up to me. Okay, good. So he was able to go faster and go back and forth normally, so that was, or within the expected range, so that was good. After this, I'll do a sharp and dull test. So I'm actually going to use, I'll just give you a feeling of sharp and a feeling of soft or dull, just as a baseline. So this will be sharp, and this will be dull.
Okay.
So if you can just close your eyes and tell me which one you're feeling, sharp or dull.
Sharp. Dull. Sharp. Soft. Soft. Sharp.
Good. After this, we'll do the graphesthesis test, and I'm just going to write a letter in your hand, and you tell me which letter I'm writing.
S.
Okay, and then we'll do it again on this side, and it could be a number 2 as well. It could be number as well.
8?
Yes. Okay, so you passed that test, but you were able to feel what that was. Familiar objects in your hands.
The familiar objects in your hands test?
We didn't do that.
You don't have to, it's one or the other.
Oh, okay, so we did that. Okay, so we're also going to do the finger to nose test. So I'm just going to hold my hand, or my finger out here, and I'm going to get you to touch your nose and then touch my finger. I'm bringing your finger back to your nose and then touch my finger again. And I'll be moving my hand, and then we'll test both sides.
Okay.
So I'll just hold my finger out here like this. Go ahead and touch it. Okay, and then we'll start on the pull on this side. Your other hand. Okay, so I noticed that his coordination was equal on both sides, so he was able to touch his nose and then touch my finger, which showed really good coordination. And the last thing that we're going to do is a heel to shin test. So all I'm going to get you to do is take your heel and run it along your shin. And are you able to feel that?
I am.
Okay, and then on the other side. Okay, and that's it. That completes our head to toe assessment. We are finally done. Term 3 head to toe assessments. And I'm sure you're happy about that too. Do you have any questions for me before we end this?
No.
Okay, so I'll just wash my hands and I'll note all my findings. And that is it. That completes it. Thank you.